The recent surge in measles cases in the United States is a stark reminder of how quickly a preventable disease can spiral out of control when vaccination rates decline. In Texas and New Mexico, where the current outbreak is most severe, cases have climbed to around 300, with dozens of patients requiring hospitalization. Tragically, at least one child in Texas has already died from the disease. Public health officials have long warned that measles outbreaks become more likely when vaccination rates drop below the crucial 95% threshold needed for herd immunity. Despite this well-established scientific fact, controversial statements from U.S. Health Secretary Robert F. Kennedy Jr. are fueling confusion at a time when clear, evidence-based action is needed. Kennedy, a well-known vaccine skeptic, has sent mixed messages, acknowledging the importance of vaccination while simultaneously raising doubts about its safety. In interviews, he has claimed that measles vaccines have harmful side effects and even suggested that they cause the same diseases they are meant to prevent, a statement that directly contradicts decades of medical research. Adding to the confusion, he has promoted alternative remedies such as vitamin A and cod liver oil, despite the overwhelming scientific consensus that these substances cannot replace vaccination. While vitamin A can play a supportive role in reducing measles complications in malnourished children, it is not a preventative measure and does not stop the spread of the virus. Experts in immunology and virology have repeatedly emphasized that vaccination remains the only reliable method of preventing outbreaks, yet Kennedy's remarks risk encouraging vaccine hesitancy at a dangerous moment. The situation in Texas and New Mexico is a cautionary tale of what happens when misinformation undermines public health efforts. The outbreak, which began in late January in rural Gaines County, quickly spread to neighboring areas. In Texas alone, measles cases have doubled in just over a month, from 124 in February to 259 in March. With a vaccination rate of just 82% in Gaines County, well below the safe threshold, conditions were ripe for the virus to spread unchecked. The Centers for Disease Control and Prevention, CDC, has long warned that declining vaccine coverage creates an open door for outbreaks. Before the widespread adoption of the measles vaccine, the disease was a leading cause of childhood death worldwide. Thanks to vaccination programs, measles was declared eliminated in the U.S. in 2000, meaning it was no longer continuously circulating. However, in recent years, misinformation and vaccine hesitancy have chipped away at this achievement, allowing the virus to regain a foothold. The consequences of a measles outbreak can be severe, particularly for children and immunocompromised individuals. Measles is one of the most contagious diseases known to science, spreading through airborne droplets when an infected person coughs, sneezes, or even speaks. The virus can linger in the air for up to 2 hours, making exposure in enclosed spaces especially dangerous. Nearly every unvaccinated person who comes into contact with the virus will become infected. Symptoms include high fever, cough, and a distinctive full-body rash, but the disease can also lead to serious complications such as pneumonia, encephalitis, brain swelling, and permanent neurological damage. In extreme cases, measles can be fatal, as seen in the recent Texas case. The fact that a child has already died should serve as a wake-up call, yet misleading narratives about vaccine risks continue to circulate, putting more lives in jeopardy. Medical professionals and public health experts have been quick to counter Kennedy's claims. Biologist Kirsten Hoeknes of Bryant University and immunologist Scott Weaver of the University of Texas have both reaffirmed that the best and only truly effective protection against measles is vaccination. They stress that vitamin A, while sometimes used to mitigate complications, is not a substitute for immunization and offers no guarantee of protection. Weaver points out that for decades, measles outbreaks were nearly non-existent in the U.S. because vaccination rates were high. It is only in recent years, as vaccine hesitancy has grown, that outbreaks have resurfaced. The Robert Koch Institute, RKI, in Germany has similarly emphasized that maintaining a 95% vaccination rate is essential to eradicating the disease. Germany has even implemented a measles vaccine mandate for school children to ensure continued protection. The resurgence of measles in the U.S. is not just a public health crisis, but a preventable tragedy. The scientific community has provided a clear, well-tested solution: vaccination. The measles, mumps, rubella (MMR) vaccine is one of the safest and most effective immunizations available, providing long-term immunity with minimal risk. Countries with high vaccination rates have successfully kept measles under control, while those with lower coverage, such as the US in recent years, have seen outbreaks return. The data is undeniable. Vaccines save lives, and hesitancy fueled by misinformation only leads to unnecessary suffering. Despite these facts, misleading claims continue to spread, making it harder for public health officials to contain outbreaks. Kennedy's mixed messaging, in particular, is dangerous because it blurs the line between evidence-based medicine and unproven alternatives. His emphasis on personal choice ignores the reality that measles is not just an individual risk. It is a highly contagious disease that affects entire communities. When vaccination rates drop, even those who are unable to be vaccinated, such as infants and immunocompromised individuals, are put at risk. The death of a child in Texas should not be dismissed as an isolated incident, but as a direct consequence of declining vaccine coverage. The current outbreak should serve as an urgent reminder that we cannot afford to be complacent. The success of vaccination campaigns in the past proved that measles can be eliminated, but only if the public trusts and follows medical guidance. The spread of misinformation threatens to undo decades of progress, leaving more people vulnerable to a completely preventable disease. While public health officials work to contain the current outbreak, it is crucial that responsible voices rise above the noise to reinforce the simple truth. The best way to protect against measles is to get vaccinated. Anything less is a dangerous gamble with human lives.